Well, good afternoon from Laguna Niguel. It's a beautiful day. It's totally clear, probably about 72, 73 degrees, and I'm just letting you know of an issue I'm going through with my health. I haven't let you know directly because I felt it more informational to do it by video, so that way I can get out what I want to say. Last year, I had what I thought was COVID, and I went to the emergency room thinking I had COVID, and I did not have COVID. And the doctor said that I have a heart murmur, and he was very excited about it. As a matter of fact, he got a nurse from down the hall and had come listen to it as well. And little did I know what this heart murmur was really all about at that time. He actually wanted me to go by ambulance to the hospital to get checked out, as I had really high blood pressure and did have chest pains at the time, but I decided not to do that. I don't know why. I just prayed about it, and I just decided I'm going to figure out on my own what it is. So I declined to go to the hospital at that time, but of course I made an appointment with a general practitioner as well as a cardiologist, and long story short, I was able to find out that I have what they call a leaky valve in my heart. And this leaky valve is commonly known as mitral valve prolapse. And basically, this is explained this way. I'm going to read my phone. People who have leaky heart valve typically don't realize it until it becomes quite severe, which is my case. A severe valve leak will impair the flow of blood in and out of the heart, which can cause symptoms similar to congestive heart failure. So basically, a leaky heart valve it sounds terrible, doesn't it? The condition occurs when blood leaks into any of the 4 heart chambers while pumping blood. And because it's leaking out and my valve isn't closing correctly, I basically have a lot of fluttering in my heart, irregular heartbeat, chest pain. It also can bring shortness of breath. It also can bring heavy fatigue and also stress and anxiety. It sounds really bad, and I hear what you're probably thinking right now, I believe. However, I went to a regular doctor and got an echocardiogram with a stress test, which basically is where I'm on a treadmill and I get my heart rate up to 150, and then I quick and go lie down, and they do an ultrasound of my heart where basically they can see what my heart pumping looks like and see what's going on. So there is the first time I actually saw the leaky heart valve, mitral valve prolapse that was creating the heart murmur, over the computer screen. So the doctor said it is one step below severe, and he suggested I go back to my general practitioner, maybe make changes with medication. I, of course, was very worried about this, who wouldn't be, and decided to change my diet. And my diet, which I thought was not that bad, but actually it was. A lot of fried foods, French fries now and then, really not a lot of greens or vegetables, and probably drinking more sugar drinks than I should have been drinking. So I decided to change my diet. So right then I was about 208, 209 pounds. And basically over the next 6-7 months, I went and got a new diet and lost about 30 pounds. I'm down to about 177 and change at this point. And have changed my diet completely, eliminating carbs as well as not having any red meat, mainly eating fish and then chicken, and trying to eat as much greens and vegetables as possible, and pretty much only drinking water. Once in a while I might have something else, but pretty much drinking water. So I went back for my second echocardiogram, which was a few weeks back, and that one was a little bit worse according to my cardiologist. And the cardiologist said that he thought that it was one step below severe, but it was getting worse, and I needed to have it looked at. So basically, they want me to get a transesophageal echocardiogram, say that 4 times fast, and that's going to basically put a scope down my throat that goes in between my lung and my heart valve, where they can get a closer look at it. And I basically set up to have this done last week, but I changed my mind in that I wanted to get a second opinion. So I actually went to a different doctor, actually a heart surgeon, who was referred from someone that Sheree and I know. And I was able to have him look at all the data, including both of my echocardiograms and also my stress test and other data. And I'll go ahead and play a snippet or a few snippets of that conversation I had with that doctor for you after I finished this portion of the video. I just want you to know that I'm a fighter. I went through cancer exactly 10 years ago. I was going through it. And I'm going to do everything I can to get the proper care and whatnot. But the long and short of it, after you hear this, I'll come back and I'll talk to you about what it actually means and what's next. So why don't we cut away for that, and I will come back.
So the disease process or pathology we're talking about is called mitral regurgitation. All right. So the mitral valve is this valve right here. So blood, goes into from the right side of your heart to your lungs, comes back to your lungs, goes in this chamber, left atrium. This valve opens, goes in your left ventricle. This is the important guy. Left ventricle squeezes, shoots the blood out to your body.
Okay.
In your case, when it squeezes and shoots the blood out to the body, this valve, mitral valve, is leaking a lot, such that it's open. So blood is some going to your body, but a lot is going back into this chamber, left atrium, and then back to your lungs. So essentially, a lot of blood is going backwards.
Okay, that's not good.
That's not good. So why does that matter? Well, a couple of reasons. So one, if not enough blood goes forward, people can start feeling crummy. Heart failure symptoms are called. And two, a lot of blood going backwards, that blood's all going to your lungs. So people can get fluid in their lungs, or pulmonary hypertension, high blood pressure in your lungs, which over the long term is not very good and give people symptoms like shortness of breath.
Okay.
Third, as more blood goes here, as you can imagine, this chamber is going to get bigger and bigger and bigger. When this gets bigger, you're more likely to go into atrial fibrillation, AFib, which with the palpitations, who knows if you've had little bouts of it already? You might have.
Okay.
And then lastly, so this chamber squeezes, blood goes out, blood goes backwards to the lungs, but then now double the amount of blood, or not double, but more blood has to flow back into the heart. So this chamber gets kind of volume overloaded. So instead of being strong, kind of efficient squeezing, more and more volume, like a big balloon that you keep filling with water, it becomes a big bag. So the strength of your left ventricle, the most important chamber, can go down over time.
Okay.
So that's why this matters.
Okay.
So when do we decide to intervene? So generally for most valve diseases in the heart, it's when it's severely tight or severely leakage, and those are based on echo numbers,
Right.
And symptomatic.
Okay.
That's kind of the classic tried and true. So if you told me, hey doc, I walked to my car, I have trouble breathing, we do the echo, it says severe, boom, you get surgery. Simple as that.
Okay.
But we as surgery has gotten safer over time, the indications to operate are a little bit less, because everything in medicine is risk benefit, right? If the risk of surgery was the risk of doing a hangnail, we'd probably operate on mild leakage with no symptoms. If the risk was 70% mortality, we'd wait till the valve was really leaking and you were feeling really bad. It's all risk benefit. So as surgery's gotten safer, the indications have changed somewhat. So kind of the new age class 1, so still main indications would be what we talked about, as well as if the left ventricle starts to get a little bit weaker. If the ejection fraction is less than 60, which is about normal, yours is right around there. Your heart squeeze is not 100% normal, it's slightly low, probably from getting a lot of fluid over time.
Okay.
Number 2, if someone has atrial fibrillation, which we don't know for sure you have yet, but you might, or pulmonary hypertension, high blood pressure in lungs, which we don't know if you have yet either.
Okay.
So those would be kind of the indications to operate if you have no symptoms. So your particular, with me so far?
Yes.
So your particular case, it sounds, palpitations is common with the kind of volume overload, so I would consider you symptomatic. So I would think you don't have to have surgery right now, but it's time, you're probably needed in the near future. You're not going to get to 70 without it.
Okay.
Now, the reason the valve is leaking, in most people, about 80% of the people, is because some of these little cords have ripped, and then the valve, instead of closing like this, the cord rips, so it's flicking up. It's called prolapse, or PP2.
So that's what I saw when I was watching the live echo. I could see that.
Yes.
Yeah.
Yes. So 80% of people have that prolapse. That's the easiest to repair.
Okay.
Because usually I put a little ring and put a stitch or two, and you're good to go.
Okay.
Yours, from the test wall echo, which is not the best echo, but from that one, it looks like both are prolapsing, and your annulus, meaning this area is really big. There's nothing wrong with that. It's just if you look at everyone in the country, the repair rate is going to, instead of being 95% chance to repair, I don't know your exact number, but maybe it's 80, 90%. And that also plays into it because repair is generally better than replacing.
Yeah.
And because if you replace, the valve has a lifespan on it. So, you don't want to go in unnecessarily. So generally those indications I told you, those are the case for if you think you can repair the valve. If you think you have to replace it, then you want to wait a little bit longer. So maybe some of those softer indications, like palpitations, maybe we would sit tight on that and wait till you had something more substantive. If that makes sense.
Okay.
So where we are now, I agree with getting a TEE next.
Okay.
A TEE gives us better pictures of what's going on with the valve. The pathology also helps us decide how we're going to repair it if it comes time to do that.
Okay.
So that would be the next step. If the TEE shows kind of normal things just like we saw with this, then before any surgery you would get a left heart cath, or angiogram it's called. It's to look at the arteries on the heart. Anyone who's over about age 40 gets that, just to make sure you don't have any other blockages in those heart arteries.
Okay.
And then we would have a better idea if we can repair the valve, which I think we most likely will be able to do, or if we think there's a higher chance of replacement, and then you could schedule surgery. So if you had your daughter's wedding in June, is it okay to wait till then? Yeah, it's not. The odds of something major happening are extremely low.
Okay.
But if some people were just wanting, I'm going to need it, just get it over and done with. Let's get it done. So those would be the options.
Okay. So is it better to get you to do the TEE?
Yeah, that's a good question. So our he's like an international echo expert. He sits right next door to me, a cardiologist.
Yeah.
I showed him your pictures, and he said if they will do like 3D images, like do a really good job and give us 3D pictures, then it would be equivalent doing it here or there. But if it's kind of we don't know, some people just kind of put it in. They're not thinking.
Well, I'm sure they do a good job, but it just seems like common sense that if you guys would end up being my surgeon, it's better for you to do the TEE.
Yeah, and he's. I asked him, because I know you may ask that. He said he's happy to do it, and he does a A+ job.
So maybe we should go that route.
Okay, that's totally fine.
Don't you agree, Cherie?
Yes, I agree that do it with the guy next door for sure. I mean, I'm sure the other team does a good job, but I'd rather you stay with all the services here.
Sure, absolutely. Yeah, we can do that. So that would be the next step.
Yeah.
And again, I don't think you need to be rushed off to surgery. You have time on your side, and we can see what that echo shows and to kind of take things from there.
Okay. All right. That sounds good.
Yeah.
And then, so we won't really know until the TEE is done, as far as how severe it is, what's really going on.
It mostly.
But what you see is definitely, like you said, if I don't do something, by the time I'm 70, I probably won't make it that long.
Yeah, and I think we know, I would consider, like I said, I would consider you symptomatic. I think this is severe.
Okay.
So we know that. We know that you need indication for treatment. The TE, it helps a lot for the preoperative planning of how we're going to repair it. Because repairing this is kind of like an
So you just do incisions around it and go in that way, or do you actually open my chest up?
That's another point. So for you, the standard and kind of tried and true way would be going in from the front.
Okay.
We do robotic surgery here, and do robotic surgery. But the robot, it's great. If things are straightforward, easy. If you had that leakage that I said 80% of people had, it's really good for that. If this becomes a more complicated repair, I'm doing stuff to both leaflets, and doing 5, 6 different things instead of one thing to fix it, that is better to be done from the front. Because the most important thing for you, you don't want to have leakage. That's number one thing.
Right.
Number 2, you want to have no leakage, preferably through repair instead of replacement.
Okay.
So I feel that, and most, there's a lot of marketing in surgery, just like in business, but most realistic surgeons would say, if it ends up being a complex repair, the safest and easiest way to do it is from the front.
Okay, so you should have heard all the details from that, and I wanted to also let you know what brought this on, what caused it. And the reality is I feel that I've had high blood pressure for a long time. And unfortunately, Grandma Laura, when she was alive, she was always concerned about my blood pressure and wanted me to go on blood pressure medication, which I just didn't feel I needed to do that. And boy, was I wrong about that. And I can't believe how right on she was at this time where I'm sitting. However, here I am, and I did change my diet, but before I did change my diet or going through the process, I actually was on blood pressure medication, and a couple months into the blood pressure medication, I started getting dizzy quite a bit to the point of almost passing out. And it turns out my blood pressure was too low because my diet and all the changes I made brought my blood pressure down. And actually right now I'm not on any medication for blood pressure, and I'm actually on just basically nothing as far as to help my blood pressure at this point. So what does that all mean? It just means that my diet was the issue. And because I had blood pressure for a very long time, that's what brought on this leaky valve, which is a very common problem throughout America, but my case was more severe. And on top of that was heavy stress, anxiety, and a lot of things I wasn't really doing right. Where I thought I was doing okay, I really wasn't. So I've been really determined to do as much as I can. Anyway, getting back to the recording, the doctor, as you could hear, recommends that I definitely get this transesophageal echocardiogram, which I've already set up. I'm going to have that done on the 17th of March. After that, he's going to determine what type of surgery I need on my heart. Most likely, as you can hear what he was talking about, I will need open heart surgery where they will crack open my chest and basically replace my valve is what he's thinking will probably be the outcome. What does that really mean? Well, first of all, there's two types of valves. There's one that's going to be an artificial valve. The artificial valve is made of like plastic, or even can be made of metal, some unique type of valve. It's a lifetime valve. However, by getting that valve, you would actually have to take blood thinners for the rest of my life. I would. And I'm not really crazy about that idea. The second option is to, as you could hear what he said, the second option, which is what I would go for if this is what I need, is either a pig or cow valve, heart valve, that can go in, and that would last 10 to 15 years. And basically, by having that type of valve, it won't allow me, or won't require me to take any type of blood thinners, as blood thinners basically can give you headaches, you get dizzy, you're kind of always fighting the being balanced and not being off kilter, so to speak. So I feel that doing the natural, like a cow or pig valve, is a lot better for me. And of course, I'm going to research this more, but most likely that's where I'm going to go. So I'm very anxious, of course, to get this transesophageal echocardiogram done so the doctor can really look at it closely to figure out how to approach this. One of the options is going in from the side of my chest, but that's less accurate, not by much. And they actually have a machine that does that, the same way the front part would be. And you might ask, well, what's this all going to take? How is this going to work? Well, basically, I would make a appointment to have my heart operated on, and after 4 to 5 days, I'd be able to go home. As you could hear in the snippet that I played for you, it's about a 5 to 6 week recovery period, and not too different from when I had my cancer surgery 10 years ago. But bottom line is, this is what I have to do. This is what I have to do to get better and to live longer and be on this earth longer as well, of course. And I just want you to know again that I'm going to do everything I can to stay healthy. And all I can ask from you is it's to pray for me if you believe in prayers. If not, best wishes for me. And just to keep in touch and not get too crazy about being overly concerned. I know this is serious. I know this is something I don't want. You don't want it for me either. but I'm going to fight through this. I'm a fighter. I always have been. That's why I've changed my diet. That's why I lost all the weight. I'm very diligent. I will continue to work very hard to keep my health going. And yes, I do have some days that are really tough, and other days aren't so bad at all. And through the long and short of all this, my work probably will suffer a little bit, as I'm probably going to be pulling back from it a little bit, as I don't want to be so hectic and frantic as I have been over the last year and a half. Anyway, it's been a real struggle to even make this video. I wanted to make it, last week, and I had a lot of thoughts running through my head, and more than anything, I'm going to beat this thing. I'm going to be okay, and I just want you to know this is what you have to do sometimes, is you do whatever it takes. Take doctor's orders. Shree's been amazing helping me look up things and verify things, and she changed her diet as well, and she's lost 25 pounds. So it kind of catches on, I guess, if your diet's not so good. But I will say this, if you're not eating well, if you have higher blood pressure, if you don't exercise, you can get away with it for quite a while when you're young, but at a certain point, it will catch up with you, which it did to me. And here I thought I was doing pretty well, and really I wasn't. That's why I'm walking every day, eating right, trying to sleep as correctly as I can. But anyway, I hope this makes sense. I look forward to talking to you soon, and have a great rest of the day or night, whenever you listen to this.
Yes. And one thing just to think about, because you have time, is that if you do need a replacement, there are two types of valves. One is called a mechanical valve. Mm-hmm. It's made of metal and plastic. It's really good because it lasts forever.
Right.
The negative of it is you have to take that blood thinner called warfarin or Coumadin, if you've heard about.
I have a relative that does it. He says it's awful.
That's one person's perspective. Yes, yeah. Yes. So what that involves is, if you're a responsible person, it's not a huge deal, but you just have to kind of keep a steady diet of whatever green leafy vegetables you eat, because if you eat too much, too little, it can alter the metabolism of the drug. You have to get your blood checked from the doctor to make sure it's not too thick and too thin. Once you're at a steady state, you can get a machine at home and do it yourself. But that's kind of the annoying part of that.
What's the other one?
The other type is called a biologic valve. It's made from the sac around a cow or pig's heart. Mm-hmm. It's good in that you only need an aspirin for it. It's bad in that it doesn't last forever. So the kind of standard number people get quoted is about 10 to 15 years.
Right.
If you were to get that now, and let's say it fails, it gets tight or leaky in 10 years, let's say. The way technology is going, there'll probably be a percutaneous solution to fix that, meaning just a poke in your groin and we put probably a new valve inside of it and be okay, most likely. Okay. In 10 years that would happen. Right. But you're kind of in the gray area of age. So if you were 70 plus, I would say biologic is very reasonable. Most would pick that. If you're in your 50s, I would recommend mechanical.
Or 63.
Yeah, so you're kind of in the gray area. So something, read about it, think about it, Google. There's no right or wrong answer, but just something, food for thought for you.
All right. Well, thank you, doctor.
You're welcome. You're welcome.
Kind of scary for me, really.
Yeah, and this is, of problems people have with their heart, this is a very treatable one. There are a lot of options. I wouldn't, hang your head and walk out of here. It's my friend who's 30-something has this sort of thing.
Really?
So yeah.
Oh, wow.
Yeah.
That's crazy.
So,
well, all right.